Hello, I'm Admiral Rachel Levine, and we're here talking about food is medicine. It is my pleasure to be here with Dr. Jessica Lee, the Chief Medical Officer at the CMS Center for Medicaid and CHIP Services. Thank you so much for joining us.
Thank you so much for having me.
In my previous life, I was the Secretary of Health of Pennsylvania and know the state health officials really, really well. So if you were going to give some advice to state health officials, how would they start to build a program that could be sustainable?
So my advice would be for states to really take a look at their existing infrastructure and where things could really be improved, where they think that they're seeing gaps in care, where they're seeing gaps in outcomes, and what flexibilities or authorities make the most sense for them to use in order to bolster that. Because we're really committed to partnering with our states in order to help them accomplish a vision for improving access and care. So it's been really exciting to see the way that states are really embracing this opportunity as a new way of providing whole person care, really focused on what an individual person needs in order to support their health. And different states are electing to do this in different ways, really honing in on what their populations need and what evidence shows has worked for their populations. So for example, many states have used things like 1115 demonstrations, but also things like home and community-based services authorities, or even some managed care flexibilities to try to approach this in really new and innovative ways. Many states are offering medically tailored meals in addition to case management and education for individuals who are pregnant and who are at high risk for complications like diabetes. These are tried and true ways of preventing known complications, especially important given what we know about morbidity and mortality among our pregnant population. People have taken different approaches to this. Some places providers are writing prescriptions, some places health plans have been more central in terms of that prescribing. And what we've seen as kind of consistently critical is the partnerships that are necessary to actually make this successful. Because we're not replacing anything that's existing. We're here to help supplement what already exists, and what's really important is to form those community-based partnerships to actually provide the services that are needed.
Well, it's going to be exciting.
It is.
Thank you so much for joining us. And remember, food is medicine. Thank you.
Produced by the U.S. Department of Health and Human Services.